Well, hey guys, in today's video, I want to talk about medications that might cause hair loss. Alopecia, aka hair loss, is a commonly reported side effect of many different medications. You may have been prescribed a medication, and upon reading the package insert, you see hair loss as a potential side effect. That might alarm you, it might make you scared, it may make you hesitant to take the medication. Hair loss is really distressing to go through. When something says hair loss, as a dermatologist, first thing that comes to mind is what type of hair loss? There are so many different types of hair loss out there, each with their own underlying cause, course, and specific treatment regimen. Generally speaking, when we're talking about how medications cause hair loss, they're going to cause generally one of two types of hair loss: anagen effluvium or telogen effluvium. So your hair grows in a cycle. There's a growing phase of the hair cycle, there's a resting phase, and there's a shedding phase. Now, when it comes to your hair, when it's actively in the growing phase, that's called anagen. Anagen effluvium is a type of hair loss where basically you have a sudden abrupt cessation of the hairs in the growing phase. They get attacked, if you will, as a side effect of the medication. And so you get a all at once mega noticeable hair loss where you have frank balding. The classic types of medications that cause this are chemotherapy medicines used to treat different types of cancer. These medications work by targeting rapidly dividing cells. Guess what cell type rapidly divides? Hair cells trying to grow hair. So generally within about 2 weeks of getting chemotherapy, patients will experience massive hair loss, 90% of their scalp. Not only can the scalp be affected, but you can also have hair loss from the body, eyebrows, and eyelashes. Fortunately, anagen effluvium is not permanent hair loss for the majority of people, and it will grow back once you complete the chemotherapy. Usually within about 3 to 6 months of stopping chemotherapy, the hair will start to grow back. And there are some treatments that can be offered to hasten the return and to lessen it overall. For example, the classic hair loss treatment, topical minoxidil, aka Rogaine. Also, there are devices that will cool the scalp. You wear them as you are getting the chemotherapy, say infusion for example, may help lessen overall the anagen effluvium. When it comes to hair loss of the lashes, the brows, Latisse is another option. Fortunately, anagen effluvium, while incredibly distressing to go through, along with having to deal with chemotherapy in the first place in a cancer diagnosis, anagen effluvium fortunately does not scar the follicle. And that's why the hair is able to grow back once you are done with the treatment. But outside of chemotherapy, most drugs cause another type of hair loss called telogen effluvium. Telogen effluvium is a type of hair shedding. Basically what happens is anytime you undergo a really stressful event, whether it be surgery, having a fever, or developing a viral illness, maybe you got in a car wreck, I mean, you name it, anything that puts a stress on the body, having a baby, will cause the hair cycle to rearrange itself because it doesn't want to prioritize growing hair in the face of stress. So what happens is the hairs that are in the growing phase, they get prematurely shifted over to the telogen phase. Telogen phase lasts about 3 months. And then you experience shedding. So 3 months after the stressful event, you will experience hair shedding, hair coming out in clumps. So it's a lot of hair coming out, but it's not going to lead to frank baldness. You may have thinning, your part may widen, you may have where you can see your scalp where you once weren't able to, but it's not like you lose all of the hair on your head. That is not telogen effluvium. It's just a lot of shedding all at once. While this is typically triggered by a super stressful event, medications can also rearrange the hair cycle, shift things over to telogen, and cause massive hair shedding. Now, just like anagen effluvium, the good news with telogen effluvium is that it too does not involve scarring down of the hair follicle. Telogen effluvium will resolve, the hair cycle will go back to normal so that 90% of the hair on your head is in the growing phase and things will go back to normal either once the medication is discontinued, or a lot of times it can go away just by lowering the dose. In contrast to anagen effluvium, where it's pretty clear cut and expected, hey, chemotherapy gonna cause anagen effluvium, it's a slam dunk. With all the other medications that cause telogen effluvium, it can be a lot more tricky because, as I said, a wide variety of things can cause a telogen effluvium. And as you can imagine, a lot of medications are initiated surrounding a stressful event. So it can be hard to tease out what it is exactly that is causing the massive hair shedding. Not only that, with telogen effluvium, the onset of the hair shedding comes much longer after the initial stressful event or initiating the medication, so there's often a disconnect. Now that you know the two main categories of hair loss caused by medications, antigen effluvium, chemotherapy, telogen effluvium, what drugs cause telogen effluvium? Number one category is going to be retinoids. Retinoids that you take by mouth, not retinoids that you apply to your skin. Retinoids you apply to your skin, adapalene, tretinoin, tazarotene, trifarotene, retinol creams that you buy in the store, retinaldehyde that you buy. These things do not cause telogen effluvium or hair loss. We are only talking about retinoids that are given by mouth. Retinoids given by mouth, they are derived from vitamin A. Retinoids by mouth are prescribed for a variety of skin conditions like acne and psoriasis, as well as numerous non-dermatologic conditions. The main side effect of retinoids given by mouth: dry lips, dry skin, and alopecia. Telogen effluvium is the alopecia. Not everyone who takes a retinoid by mouth, however, goes on to develop telogen effluvium. The retinoid-associated alopecia, the telogen effluvium from retinoids, a lot of it is going to be related to how high of a dose you take and how long you're on it. Isotretinoin is the oral retinoid given to treat acne. Once the isotretinoin course is complete, again, the hair cycle goes back to how it once was. And actually, if the hair shedding is really significant, it's really impacting the patient, then one might consider lowering the dose, and that too can lead to an improvement. Another oral retinoid is called acitretin. This goes by the brand name Soriatane. It's used to treat psoriasis. Over 60% of patients who take 40 milligrams of acitretin a day for 6 months or more will develop telogen effluvium. Just like with isotretinoin, once that medication is discontinued, the telogen effluvium resolves and the hair shedding will stop. Just takes time, but it's not a permanent type of hair loss. As a side note though, telogen effluvium can also come about as a result of an adverse side effect from taking too much supplemental vitamin A. Lots of case reports of this. We know it is a negative side effect of taking too much vitamin A. So I always caution about that. You know, dietary supplements, they are not without risks of harm. Many of them function just like drugs do and have similar side effects. The only difference is, in contrast to drugs, there's no package insert warning you of these side effects. So when it comes to retinoid-associated alopecia, the telogen effluvium that patients might develop on these, again, not permanent, and it can resolve once the course is discontinued, once they are off the medication, or it can actually resolve by lowering the dose. All right, the second class of medications associated with alopecia, telogen effluvium is going to be anti-fungals. Anti-fungals, as the name implies, are used to treat fungal infections. So there's a class of antifungal medications called azoles. Ketoconazole, fluconazole, voriconazole, anything that ends in azole is, well, an azole antifungal. So fluconazole, you've probably heard of diflucan before. Fluconazole given systemically, meaning internally to the whole body, can cause alopecia in the form of telogen effluvium, usually within about 3 months. And it's something that is seen mostly in patients who are taking 400 milligrams or more a day. And it resolves in the vast majority of cases within 6 months of discontinuing the medication. It also can resolve just by decreasing the dose by 50%. Another azole antifungal is called voriconazole. Now, this is one that is given to treat really, really serious fungal infections that are like what we call systemic, meaning internal, invasive, involving organs and things, issues that people who have weak immune systems are significantly at risk for. They may have to go on this medication. Voriconazole structurally is very similar to fluconazole, but it's, like I said, used to treat serious invasive fungal infections. And about 80% of patients who take this medication do develop telogen effluvium. With voriconazole, the hair loss, again, reversible with discontinuation of the voriconazole, and it also can go away by switching to another azole antifungal medication in this class, itraconazole or posaconazole. So that's another option. All right, the next class of medications we'll call psychotropics. medications used to treat psychiatric illnesses. Now, some of these medications are also used to treat other things besides psychiatric illnesses. The first medication is one called valproic acid. Valproic acid is a mood stabilizer, and it's also an anti-epileptic. It's used to treat bipolar disorder, but it's also used to treat seizure disorders. It's used to treat certain types of neuropathic pain, and it's used to treat migraines. Valproic acid does cause telogen effluvium. It causes a hair loss. Usually within 3 to 6 months of starting the medication, you can develop hair loss with this telogen effluvium. It appears to be dose related, and so if this develops, it can be managed by lowering the dose. The next medication is one called lithium. Now, lithium is a drug used to treat bipolar disorder. It can be very, very effective for that condition. However, it has a lot of side effects. One side effect you may read about in the package insert is, well, hair loss, right? That's what this video is about. The tricky thing about the hair loss with lithium is, yeah, that's what's reported as a side effect, but it's not really clear that it actually causes hair loss. What is more likely, and what you should alert the person monitoring your lithium about if you are developing hair loss, is that a side effect of lithium is actually hypothyroidism. And when you have hypothyroidism, that can cause hair loss. So if a patient on lithium develops hair loss, that's a reason to check their thyroid, because the lithium could be impacting the thyroid rather than necessarily a direct effect of the lithium on their hair. All right, then we have SSRIs, selective serotonin reuptake inhibitors. These are antidepressants. A lot of people take them. Depending on the medication, they may be used for other things as well. Alopecia is listed as a side effect of SSRIs, but there are actually a lot of large studies looking at the frequency of reports of hair loss with SSRIs, and it's actually pretty low. There are a lot of different SSRIs: citalopram, escitalopram, sertraline, fluoxetine, and it's hard to say if they actually do cause telogen effluvium or hair loss. That being said, some patients do notice an increase in hair shedding with the medication, but again, remember, stress is a big trigger for telogen effluvium as well. So some cases, patient may have actually gotten telogen effluvium from being stressed out, under a lot of emotional stress from their mental health problems. And so that might be one potential confounding factor there. Some people actually who do end up developing telogen effluvium on an SSRI, it actually can resolve when the SSRI is switched to another SSRI. So if it's really bad, that's an option. One thing I'm going to interject here that's really important as we're going through these medications: if you take any of these and you're concerned that your medication is causing you hair loss, don't just abruptly stop your medication. It can be very detrimental to your health, especially, most of these medications actually that we're talking about today can be really bad to just cold turkey stop. Talk to your doctor. And they can either lower the dose or wean you off of it. You don't want to just abruptly stop an SSRI, or honestly any of these medications, like I said, that we're talking about. All right, the next class of medications we'll call anticoagulants, blood thinners. Now, these are prescribed for, people who are at an increased risk of making blood clots. That might be somebody who just had a surgery, who's immobilized in bed. It might be somebody who has had a heart attack. Use anticoagulants there. Someone who's already made blood clots. It might be someone who has a medical condition that makes their blood prone to clots, like a lot of autoimmune conditions like lupus, for example. Also, patients who have cancer, their blood is much more prone to clotting. So these are all scenarios where you may be prescribed an anticoagulant. What are types of anticoagulants? So there's heparin and warfarin, aka Coumadin. I'm not going to get into the different types of heparin. That's kind of beyond the scope of today's video. Alopecia was first noted with these when they were first becoming more widely utilized in medicine in the mid-20th century. Some people do develop a lot of hair shedding, telogen effluvium, within the time frame consistent with telogen effluvium of starting these, so within about 3 months. It's also hard to tease out though, because as you can imagine, people who get put on heparin or warfarin, typically there was some medical event or underlying health problem that led them to be on that. So it can become quite difficult to tease out. Was it the surgery that you had? Was it another medication that you were on? Was it the underlying health problem that actually caused the telogen effluvium? Outside of heparin and warfarin, we have these blood thinner medications now called direct oral anticoagulants. Basically, as the name implies, you take them by mouth. They have fewer overall side effects, a better safety profile, I should say. These have complicated names: dabigatran, rivaroxaban, hard to say, honestly, it's a mouthful, and apixaban. This class of medications, though, is another one where it's not really clear if they do cause hair loss or if it's hair loss people develop related to the reason they ended up needing to be on the medication in the first place. So if you have been prescribed these and you see hair loss listed, understand that it may not actually be a side effect truly of the medication. It may just be, circumstances related to being prescribed these medications. All right, and then the last category is one that, a lot of people are on: antihypertensives, basically medications for high blood pressure. These you will frequently see in the package insert say hair loss is a possible side effect. So there's a class of medications for high blood pressure called ACE inhibitors, angiotensin converting enzyme inhibitors. These are used especially for people who have heart failure because they can improve mortality, death in those patients. These medications end in pril, P-R-I-L, captopril, enalapril. There are limited case reports here and there of patients developing hair shedding, telogen effluvium on these medications, but it's thought to actually be quite rare. And if, the package insert might say, increased risk of hair loss as a possible side effect, but it's anywhere from 0.5 to 2% with, captopril, one of these. But actually, that's the same rate as the placebo was compared to. So it's not really an increased risk so much, but just something for you to be aware of. Again, just because the package insert lists it as a possible side effect, it's like, is it the drug or is it, something else? Then you have another class of medications called beta blockers. These end in alol, like propanolol, metoprolol, carvedilol. This is another class, though, where it's limited to case reports here and there. By and large, it appears to be uncommon. Now, within the realm of antihypertensives, let's talk about a medication called minoxidil. All right, so minoxidil is a medication that you take by mouth. It was originally there for blood pressure, but it doesn't really get used that much for blood pressure. In contrast to telogen effluvium, this causes kind of the opposite problem: hypertrichosis, excessive hair growth. Because of this, sometimes that's desirable. Some people have hair loss and they want to correct it. That's why topical minoxidil, aka Rogaine, was developed. The thing about topical Rogaine, which is not used to treat blood pressure, and this is just a medication that you're applying to your scalp. The thing about topical Rogaine that I always have to tell patients is that, so initially when you start minoxidil, you do experience an increase in hair shedding, but it's not true hair loss. It's always, alarms patients. I thought this was supposed to help with my hair loss here, and I'm putting it on, I'm getting more hair coming out in clumps. That's a temporary thing. It's just rearranging things. That's the topical minoxidil. However, nowadays we're using the oral medication minoxidil a lot more to treat not just androgenetic alopecia, but a lot of different types of hair loss. It can be very effective. It does cause unwanted hair growth on the face, so it's all about getting the dose just right so that that doesn't happen like women are not so keen on having facial hair growth. It can have some other side effects, but it actually can be quite effective. As a matter of fact, I have a whole dedicated video on oral minoxidil for hair loss. So if you are dealing with androgenetic alopecia, check that one out. So minoxidil, kind of the opposite issue here, hair growth. Aside from with the topical, you have that temporary increase in hair shedding. So those are the medications. Take-home points though, medications cause typically one of two types of hair loss: anagen effluvium, where it's 90% of the hairs on your head going all at once. Chemotherapy can affect the brows, the lashes. And then you have telogen effluvium, which is the vast majority of the other medications. Telogen effluvium, increase in hair shedding roughly about 3 months after starting a medication or going through any type of stressful life event. So it can be kind of hard to tease things out, especially given that there's a delay. But importantly, both anagen effluvium and telogen effluvium caused by medications, these are not scarring types of hair loss, meaning the hair can and does grow back either when the medication is discontinued, like for example chemotherapy, and or by lowering the dose of the medication, especially in the cases of telogen effluvium. I know that hair loss is really terrifying and very stressful to go through, but hopefully this video, clarified to you guys how and the types of hair loss that medications may cause. Don't just stop medications without talking to your doctor. It can have pretty detrimental effects depending on what you're taking. So I hope this video was helpful to you guys. On the end slide, I'm actually going to put a recent video all about a shampoo that actually can help with certain types of hair loss. So check that one out next if you are so inclined. But if you guys enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.